Hi, I'm Dr. Sandra Elmer. I'm a urologist and a women's pelvic specialist, and I'm very proud to be part of the endota wellbeing conversation. I'm a urologist and I have a special interest in female pelvic medicine and reconstructive surgery. I love advocating for women's health and helping them through the journey, through life and all the different life stages they may face with their pelvic health. In this conversation, we explore how hormonal transitions, including perimenopause and menopause, influence bladder function and pelvic health. We'll discuss common changes women may experience and practical ways to support pelvic wellbeing. So the pelvic floor, the pelvis and its organs like the bladder and bowel have a lot of estrogen receptors. And so when estrogen levels are normal, these tissues and organs are healthy, strong and supple. When estrogen levels decline, these tissues start to become thinner, weaker, they may even become inflamed. And estrogen levels can decline in a lot of different periods in a woman's life. Typically, perimenopause, which can happen 5 to 10 years before menopause, and then from menopause and onwards. And we know that by about the age of 60, women aren't really producing any estrogen anymore. But it's not just menopausal women who have low estrogen levels. It's also young women who may be on the oral contraceptive pill, women who are breastfeeding, women who may be on medications for things like endometriosis or fibroids or even hair loss medications. And there's a big group of women who have had cancer treatments, who may be on chemotherapy or hormone suppressant therapy for breast cancer, and their estrogen levels decline too. When estrogen levels decline and it starts affecting the pelvis and its organs, we call it the genitourinary syndrome of menopause, but it could be the genitourinary syndrome of lactation. But basically it just describes a syndrome which can affect the bladder, the urethra, the vagina and the pelvic floor. So with regards to the vaginal symptoms, women can experience vaginal burning, dryness, decreased lubrication that can make intercourse uncomfortable or painful. They may experience bleeding after intercourse. They may experience vulval or vaginal burning, and also decreased arousal, desire and even orgasm. If women's sexual function is disturbed, it does then have a roll-on effect to the rest of their lives, their personal health and even their intimate relationships. The urinary symptoms we commonly see are urinary urgency, frequency, they may experience pain when they're urinating, and really importantly, it increases the risk of urinary tract infections. And in older women, this can be life-threatening, so it's something to be really aware of. If you're starting to see signs or symptoms of the genitourinary syndrome of menopause, so issues with your sexual function or increased urinary urgency or incontinence, or if you're having recurrent urinary tract infections, it's important to ask your GP or supporting care providers certain things. Is there anything abnormal? Are there any tests that I need to do? Especially if you've got urinary incontinence and pelvic floor prolapse. Is there a good pelvic floor physiotherapist in the area that you could see? If you're not up to date with your pap smears, ask your GP, do I need to get an up-to-date pap smear? If you're finding that you're having to go more frequently than you have before, or you can't make it to the toilet in time, or having incontinence is stopping you from actually going out and living your full life, please see your doctor. Ask them about low-dose vaginal estrogen and how that could be prescribed to you. Because again, there are very easy, safe, simple treatments for these problems. Understanding how the body works helps us care for it more intentionally. Explore more simple ways to support your health and longevity with the endota wellbeing conversation.